Hey, hi everybody. Good evening. Hi. With Dr. Karishma, who would be joining us in a while. Yes, she's here.
Hi,
Hi, Doctor.
good evening.
Good evening, good evening. We have still people are joining in, but
Okay.
just starting it off here. Today, hello everybody, a formal hello, good evening again. We are doing a live today with Dr. Karishma, who, by the way, is a renowned plastic and cosmetic surgeon with an experience of close to 15 years. And I have been to her clinic up to number of times and have done a lot of pamper sessions, and I completely trust her. And as you would understand that because of the surgeries and the fillers and the botox are no longer a taboo now, and I wanted to have this conversation, like me and Dr. Karishma. I had went to a clinic and we were having this conversation, and we realized that we have such a big taboo around any of the cosmetic procedures out there, and people are doing it but are still doing it in a hush hush way. So there is a taboo involved, and there are a lot of questions too. You have so many skin clinics, so many treatments, and we almost are bombarded, Dr. Karishma, about the various treatments which are there. So a lot of people had questions in. So I wanted to start off by getting it answered from the expert herself, which is Dr. Karishma. And yeah, so that was the introduction at the beginning. And
So,
with that,
hi
doctor, I would
everyone, and
start.
hi everyone, and firstly, thank you, Tanvi, for inviting me on this live and deciding to do this live session. It's always fun, and yes, first of all, I think. In general, I find that there's a lot of misconceptions about a lot of cosmetic treatments, misconceptions, myths, the Google half knowledge. And, it's more important than just talking about treatments. I think it's about spreading the awareness and the safety about these treatments. And not all of it is bad. The problem is when it comes to cosmetic treatments or plastic surgery or any cosmetic related treatment, it's always one negative issue which gets publicized, but a million other good that has happened somehow never comes on the forefront, and we always land up reading the negative, not the positives. So we are here today,
Exactly.
I think, to talk about the positives and how you can make your treatments safe wherever you're doing it and with whoever you're doing it.
Agree, agree. And with that, Dr. Karishma, I had put up a questionnaire, a poll, just a day before, and I have had a couple of very similar kind of. I had a couple of themes around which I had mostly the questions on. So I'll start off with that, and eventually we could take questions of everybody who is joining in. So please feel free to whoever is joined in new. Hello, hi. We are talking about all about cosmetic treatments today, and about botoxes and fillers and what are they? Are they safe? How is it done? Is it needed? And etc. All complexities answered by Dr. Karishma herself. So, doctor, the first question which I got asked was, if you could simplify for us, what is Botox?
Okay.
Yeah, and
So,
what is Botox? The everything around it, whatever we need to know.
okay. So for you to understand is, first of all, the term Botox has been used by one particular company.
Okay.
There are various companies which we do Botox with,
Okay.
and Botox particularly is from a particular brand, and in fact, only they use the word Botox on the box. In general, it is nothing but a botulinum toxin. And when I say toxin, again, we should not get scared. It is from a natural living substance, a Clostridium botulinum, where this particular agent is being extracted. So it is extracted from something natural available in our environment. And
Okay.
all it does is relaxes muscles. Now, there are various doctors who use different kind of companies. The same Botulinum is used in one company headed by the name Botox. There could be something like Dysport, which is the same thing but by another company. So obviously the term Botox has got generalized with everyone. It is absolutely safe, and remember, people get confused fillers and Botox. Botox is only to relax the muscles. So where do we relax our muscles? In fact, before the use of cosmetic surgery, Botox was widely used by the neurologist for medical purposes.
Okay.
So it was used to treat migraine, first and foremost. It
Okay.
was extensively used by neurologists. We treat migraine, and what initiates migraine are the muscles. You know, there are these temporal muscles, there are muscles at the back of the head. And people who have had migraine or know about migraine, you'll realize there are certain muscles getting hyperstimulated, causing those headaches. So we would inject Botox in those muscles. So what it would do is relax the muscles, and your headaches and the frequency of headaches are reduced.
Okay.
Okay?
Okay.
So Botox is initially used for medical purposes. It was used for a condition called hyperhidrosis or excessive sweating. Excessive sweating of the palms, of the feet, of the underarms, any area of the body. And also to reduce shrink pores. So minute Botox, we dilute it very minutely and we call it micro Botox. It was used to inject just underneath the skin, because if for everyone's information, even our sweat glands has a muscle attached to it. That's how it pumps the sweat and the sebum. Even say in our face skin or its underarm or anywhere else. So when you micro Botox just underneath the skin, we are actually targeting the little muscles around the sweat glands, which gets relaxed, so your sebum and sweat production reduces.
Okay, got you.
Okay. Now, when all this happened, people slowly realize that why not use it for cosmetic reason, and then the age of Botox for your facial wrinkles came and facial rejuvenation. Okay, so the only reason we do Botox cosmetically is why we are rejuvenating, because the concerns by people are, I've got frown lines when I smile, I get too many lines on my forehead, or crow's feet, and we talk about smile lines.
Yes.
So we basically injecting this little Botox into that muscle, so we're temporarily relaxing the muscle.
Okay, got you. And what is the temporary time duration?
4 to 6 months on an average. 4 to 6 months. Yeah. So when you're relaxing the muscles, when the person is making the expressions, those expressions will be slightly less pronounced.
Yeah. That's why you see.
So, but then again, I like to do for my patients Botox in minimal to moderate quantities. Now, why do people make Botox? Oh, her face was Botox, or he Botox too much. Some people can overdo the Botox, and when it's overdone, when you're overtly relaxing the muscle, then what happens? Then it becomes like an expressionless face.
Exactly.
Because I'm paralyzing it too much. So if when we talk about a natural result, what is the meaning of that natural result? Natural result is like I'm making my expressions. At the same time, people can't figure because my expressions are still happening, but it is minimized.
Yeah.
Right?
So that line has to be very much taken care about, the amount of Botox which you need to pull in. And what do you suggest, like, if I have a usual concern and come to you in a very layman term saying that I look old, I've started looking dull, my elasticity is gone, like generally if I come, because I've got this question that my face is looking dull, it doesn't have that glow which I would have in my 20s, or what do I do? I'm scared of Botox because that is needles. What else would you suggest if anybody is scared of needles?
To clarify, Botox is not for the glow.
Okay.
See, using Botox, we are just minimizing the hyper intense wrinkles on your face.
Okay.
Now, see, if you are frowning and you're getting these very prominent, some people have a prominent frown. Some people, as we age, our muscles are dynamic, right? We are making facial expressions, right? And obviously, there are a few people whose certain muscles are more hyperactive than the other. And they may start wrinkling faster. So there are two types of lines. Now, when I say I make this expression and I get these 1 or 2 lines, these are lines happening when I'm making my expression. When I'm making the expression, those are called dynamic. As
Okay.
for some people, after some time, they tend to, their muscles are so hyperactive that even when they're not smiling, these lines stay permanent. The
Ah,
lines
right.
become
Even if they're not doing it,
after
the lines are there, right?
after
Okay.
a particular age.
Yes.
After a particular age. And for
Yes,
some
yes.
people, faster. For some people, maybe they are lucky genetically. It happens much later. Their skin quality is good. Those muscles are not very hyperactive. But for
Yeah.
some people, especially forehead, is a very hyperactive. It's a very strong muscle. So they
Mm-hmm.
start getting those static lines, which even if
Okay.
they're not making expressions are there. And obviously some people are conscious about, it could be their profession, but it's just otherwise conscious about it, So we
Yes.
give Botox to keep the muscle in a state of relax. So the forehead and all these things look smoother. The wrinkles don't appear so much when you're making
Yeah.
expressions, right?
Yes. Yes. Yes.
Yeah.
Yes.
So that is you. So it is not for the glow. Yes, the face looks rejuvenated. How? Because those wrinkles look less. Their frown looks better. So like some people say, they come and tell me that people tell me that I'm always looking angry.
Hmm. Right.
So
Right. Yeah.
their expressions become better. The
Better.
expressions
Okay.
are there. So for
Okay.
rejuvenation, for a glow, you have to do skin treatments where you're exfoliating the skin. That is when you
Uh-huh.
talk about medifacial, a carbon laser, hydra-facial, and all of these treatments. These are for your glow. That is for
Uh,
exfoliating the skin and causing the skins. We're working on the skin surface. We're working on texture and its hydration.
okay. Got you. Got you. Okay. Another question which I had was about a birthmark. Somebody mentioned that she got a birthmark surgery done few years back, but but the edges haven't yet. They can still feel the edges. See.
Right.
So she asked me, like, what is the treatment which could be done, or could it be rectified? Like, generally, you could
So
answer around birthmarks or scars on the
Burn
face.
wounds are very difficult, even with all the lasers that we have,
Uh-huh.
especially if it's on the face. It's on very central features. The face, you can't even remove it surgically. You may get scars in return. And even all the lasers that we have could burn off the certain birthmarks to some extent, but it
Mm-hmm.
always leaves a faint shadow or a faint
Ah,
mark. It's very
okay.
difficult. So I've had people who had birthmarks over, this upper lips, sometimes a white, even not a black patch. It could be a white birthmark patch also.
Okay. Okay.
But in what I've done is for many of them, I've sent them to a tattoo artist that I know. He does
Uh-huh.
medical tattooing. And what he does is he tries to shade the color of your skin onto the birthmark.
Ah,
So it's like
that's
you're
nice.
camouflaging. Yeah.
That's
So
actually nice.
I had a guy who had a white patch. He said it was there since birth, and he was a little brown skin. So he did a little bit of the brown colored shading onto the white and kind of camouflage.
Yeah.
But
Okay.
if it's a black birthmark, then it's very difficult. I had one girl. I attempted the laser on her. She had a black, very deep spot in the center. So we counsel the patients and we tell them, like I told her, see, even if I take it out, there will be a brown patch scar.
Yeah.
She's like, I can cover the brown scar with makeup, but I can't cover with the black.
Wow.
Like
Wow.
it's just sitting, all my clothes. So we can do the removal with a CO2 laser, but she always has a faint. It took 1 year for that scar to settle, become soft. It's now like a light brownish, sort of whitish skin, close to her skin color, not completely 100%, but she's like, she's okay with it because she can still cover that with makeup, but not that black, dark birthmark. So
Okay.
you
Got
can
you.
burn it with a CO2 laser, you may get like a brownish scar in return.
Okay. Cool, cool. So we covered that, birthmarks could be covered by CO2 lasers or by skin tattooing, which I never heard of, but I think actually is something very great. Okay, and another thing which I wanted to ask you about, fillers, like augmentation of a particular body part. Talk about, you are unhappy with a body part, like you're working out, and I keep seeing so many amazing body contouring surgeries which you keep doing, like reduction of arms, and then if you have a heavy lower body, you try to tone it, getting those flat tummies. I mean, they all look very, very fancy to me. Although I am a bit scared to go to that way yet, as I understand it requires a lot of willpower and, a deep desire that I want to do it and I want to get it done. That's another story. But I want to understand that in which cases do you suggest a person, would undergo such kind of augmentation? Like, the person has tried exercises, diet, and I understand there's a lot of loose skin which happens sometimes. So how do you rectify it? What is the number of, the hours, like the hospital hours the person has to spend in? How complex is it? Is it life-threatening? Any side effects and things like that?
So,
All about body correction
so
surgeries.
quickly, let me tell you about fillers, and we'll complete fillers and Botox. I told you and I explained to everyone what is Botox. It's relaxation of the muscles. So its only job is to reduce sweating, treat migraines, wrinkles, rejuvenate the face so that the wrinkles appear less and you look much younger. Definitely, when wrinkles appear less, when you're making expressions, the skin looks more softer and cleaner. Whereas fillers, is a substance which is made up of a natural sugar of the body. Like we have hyaluronic acid in our entire body. It is a naturally occurring sugar. And this hyaluronic is prepared synthetically, and that is what is there in your filler. So I don't see why people are so hung up on I will never do fillers. We have hyaluronic in our entire tissues of the body, in our collagen. In fact, hyaluronic is needed to give the suppleness to our skin. So fillers can rejuvenate. When you asked about rejuvenation, I said, what does fillers do? It enhances, it augments, it volumizes, but because it's got hyaluronic, it also rejuvenates the skin above it.
Exactly.
So if someone is looking at the under eye, now the biggest complaint, the commonest question I got for most people is dark circles. And most of us start dark circles really early and they develop hollowness under the eye. And this is what we call a tear trough area, this triangular area under the eye. So we use the fillers not only to give a little volume under the eye, but that hyaluronic helps to rejuvenate that skin. So that is why that skin and the eye looks better after a few weeks. Okay, and so then we use it people who have flatter cheeks, who want like the high cheekbones, they want to get the cheek skin. The fillers act like a foundation stone. So when it's basically we inject it in different layers of the skin, right from the bone up till the skin. And depending on where we inject it, we get the final result. If we are going down deep, we will get the lifting effect. So we need not volumize, but we can lift. But if we are purely doing it for volume, we will go at deeper levels as well as superficial levels. So we can use it to volume, we can use to lift tissues, we can also, because it's hyaluronic, it finally rejuvenates. So that's why we have those skin boosters, which, they're not a filler, but they're just a very thin gel of hyaluronic, and that we inject very superficial on the skin. And, that is what the hyaluronic is doing. Within 3 to 4 weeks, people start seeing the skin is feeling softer. It's looking glowy, hydration. So that is not a filler. Those are hyaluronic skin boosters, and you have hyaluronic fillers. So fillers are totally different. Botox has a totally different, mode of action.
So the volite is like that filler? Like a booster? Volite is like a booster.
Volite is the booster. It's again just a name of, it's a company name. You get various companies which have hyaluronic skin boosters. There is Restylane by Galderma, Restylane Vital, then Volite by, Allergan companies. So I don't want to get into any company specific. Every doctor has their own preference, and each of these have their own specifics of how much of hyaluronic is there, what is the strength of hyaluronic. And I think that's just for the doctor to know, but each doctor is comfortable with a certain particular type of product, where they're comfortable using with their patients. So I think that's left to the discretion of the doctor. But fillers are for volumizing, rejuvenation. It is hyaluronic acid. Botox is a botulinum, and it's purely for relaxation of muscles to either for medical reasons or to minimize the wrinkles on your face and rejuvenate, so that your wrinkles appear less. So these are totally different.
Yeah. because I'll tell you from my own experience, and I want to share like the Woolite. I had got a Woolite done, and it was a very, I wouldn't say painless. I am not anti needles, so I didn't had that fear. So it was done, and that hyaluronic acid was injected, and I could see the difference for a straight 9 months. And it
Yes.
didn't do anything to my face except increase the suppleness. And I think the doctor even convinced me to have a bit of hyaluronic injected on my lips. And trust me when I say this, I did not need a lip balm for straight 9 months.
Yeah. Yeah.
Because the lips weren't dry at all, because you
Yes.
had that
Yes.
hyaluronic acid
Yes.
there. So I think one of the treatments, you could correct me if I was wrong. I'm wrong. Like one of the least invasive treatments which I could find was Woolite. Like as a as a customer or as a non-medical person, I could feel that okay, Woolite is something which would give me that glow, and it is natural because it is hyaluronic acid which my body is producing. I'm not getting any
Yes.
foreign substances
Yes.
inside. And
Yes.
being a person who has done that and had found great effects and no adversity, I think that did not
No,
have
so
any side effects for
yeah,
me.
it's very simple. It's just like how
Yes,
people do PRP on the skin. Now, PRP
exactly.
also has growth
Yeah.
factors, and people call it the vampire facial, but it's like it's a very old treatment now.
Yeah.
Now it's more than a decade old.
Exactly.
So if someone tells me I want to PRP to get it, I may have to do every monthly PRPs for at least 3, 4, 5 months to give you the changes. Whereas
Okay.
now we have these hyaluronic skin boosters, whereas one injection within 3, 4 weeks, people start seeing the changes and it lasts for good 6 to 9 months. So, we can give both the options to people that you either do PRP, but then you have to do monthly to actually
Yes.
see. And
Yes.
you might as well do this one injection and 6,
And
7 months or
the
9 months,
monthly
you're good to
sorted.
go.
Right.
Yeah, at least a year. Say on the upper side, at least
One
1 year, you
one year.
feel good. And obviously, this is not the only thing. I mean, you would know that you have to top it up with the right topical skin products and have a proper
Exactly.
skincare regime to
Exactly.
maintain it. And it's not just if you've never done anything in your skin and people are coming and asking, I want Volite. I said, but before doing Volite, I think first you should exfoliate your skin. You've never done a skin treatment. If
Yeah.
someone has never done any skin treatment, start with a medifacial, a
Uh-huh.
basic medifacial,
Okay.
like the last one that you did when you came to our clinic.
Yes.
So
Yes.
it just peels off, takes off one superficial layer of dead skin cells,
Yes.
exfoliates, opens up your pores. Then the skin is ready to do the rest.
Yes. Yes. We have a question: how to get a glass skin like Alia? That's like a very basic question. Even I want to get a skin like Alia.
I mean, glass skin, of course, it requires maintenance. And now, uh, Alia Bhatt would be in a profession, and whether or not you're in that profession, see, I have a lot of clients who come who are from the theater, from dance, or who are models, and they are even more particular. They may sometimes want to do more Botox than another person because, see, they experience very harsh lights. And when they're constantly under harsh lights, even the finest of lines, wrinkle
Are
and
shown.
and any kind of small flaws on the face are shown, so it's more the reason they have to maintain twice more than us
Agree.
you know
Agree.
but
Agree.
but honestly, a clear skin, it starts with your lifestyle, starts with your nutrition, your workouts, and coming on to just finding the right skincare routine. So meet your it's very important you meet your professional, get your right skincare plan in place, and then do once in a while a proper skin maintenance treatment. And then everyone can have a clear
Glass
skin
skin.
and a
Exactly.
glass-like skin.
Exactly.
But the
And I think it's
maintenance has to
genetic
start
too.
from, sorry?
It's genetic too, of course.
Yeah.
Like the
Yes. 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 Very
but with
much
right
genetic. Or
treatment, you could turn the genetics to your favor. Is what I
start,
understand. The
I think
medical
start
treatments out
early.
there.
Then start early, start in your 20s.
Yes.
Start in
Yes.
your 20s, start early. If there are young girls or boys who are having acne, please, by 17, 18, you can do a lot of mild chemical peels for a 17, 18-year-old and treat acne at an early stage so that they're not left with marks and coming to us 10 years later with deep pitted scars
Yeah.
and pores.
Yes, yes. So somebody has asked, like, which is a very apt question about the finance part of it. Like, most of the time, we would want to know where the treatments would start, because there is some pigmentation, like somebody has just mentioned, that because of the finances they are unable to take those treatments, right? So if you could enlighten us, like Botox, etc., from a layman would always look like, okay, it can be only done by celebrities or by people with big deep pockets. So we really would want to know, if I want to go for a basic chemical peel, which would help me to reduce the acne scars, or remove the pigmentation, of course, like a session wise thing. If we could just have a rough estimate on what it is, I think that would answer a lot of
So
questions.
the thing is, see, home remedies work really well. To a certain age, I myself have done a lot of home remedies. My mother would tell me, put the basin pack and for the detan, and to some extent, they are good. Natural products could be good to a certain, but if people have medical skin issues like acne, scarring, a genetic issue of pigmentation, then
Yes,
unfortunately, at one point, the home remedies stop working. And
exactly.
then the most reasonable thing you can do is one of the medifacial or chemical peel. So, see, when people talk about, they think that it's so expensive, but at one point before all these cosmetic treatments came in the market, and even I have gone to a salon and done a facial 15 years back,
Yes,
where I myself as a plastic surgeon, I was only into plastic surgeries. I had no clue about skin treatments, personally speaking.
yes,
And, even 10 years back, a facial at a salon would cost you nothing less than 4 to 5 thousand.
agree, totally,
So
totally.
I don't know why. I think people need to remove that misconception that the chemical peels are medifacial expensive, because even a chemical peel can cost you from 2 to 4 thousand. Even a
Exactly, exactly,
medifacial is about 4 to 7 thousand, depending on
exactly,
clinic to clinic. See, it is
exactly.
very essential that you people must know that different clinics have different equipments, which have costed us differently in terms of investing in those equipments.
I know.
It could be a different kind of clinics. It could be a smaller clinic. It could be a big multi-speciality hospital. It could be a private center, and so it every clinic could have a different price range. Why? Because each one has a different equipment. So based on those equipment, they are going to charge. Also, depending upon the to be honest, the professional degree of the doctors,
Agree,
there could
totally.
be certain certain clinics would which be working with I don't know, professionally speaking, they could just be cosmetologists, but there could be certain clinic having masters, MD dermatologist,
Agree.
or an MCH plastic surgeon like me,
True, true,
and
true.
even the degrees of the doctor count, their numbers
Agree,
of experience count, the years of experience counts. I think all of this makes up the cost. But the most
agree.
reasonable thing one can do for simple sun tanning, just getting a glow, was a simple medifacial and a chemical peel. And I think done on the doctor's hands would be any day better than a salon facial. I mean, I'm not against the salons. I still go to the salons. I get my pedicures, manicures, massages, hair. You know, but I have always, because when I got to know from my own colleagues who are dermatologists and they had their clinics way before I started my own private cosmetic center. I was just practicing plastic surgery at one point till I opened my clinic 5 years back. And my colleagues would call me and they said, stop going to the salon and come and do a treatment. And that's when I started my laser hair reduction journey with my colleagues. They are experienced dermatologists. And then I started doing the medifacial and I realized that what I was doing in the salon, it was good. But after a week, it's gone. Like I can't see any
True,
change. Whereas when I
true.
did a medical related facial, I'm seeing that okay, at least 3 4 months I'm good. And in my
Exactly.
work, I don't have the time to do one every month.
True,
So
true.
so medically speaking, and not just to promote anything
I
that
know.
we do, I think whichever dermatologist that you trust or your cosmetic surgeon, please trust their hands, trust their treatments, because you will have longer lasting results.
Agreed.
And of course, I wouldn't be biased to anything. Even the salon facial, there are certain salons which are now getting much better and better. And we are
Agreed.
seeing much new, good salons coming. 10 years back, there were not so many, but
Agreed.
today there are various. And they are also doing fantastic. But if you want long lasting results, I think you can spend this small amount and get, then you just have to do it once in 3 4 months. Whereas
Exactly.
so it's up to a person. I really don't think it's so expensive. Botox also, including, if you're doing small quantities, You don't have to do a large quantity in one go.
Yes.
You'll be surprised within about 6 to 8 thousand, you can get your whole forehead, frown, whole
Ah,
half of the face rejuvenated within
ah.
about 8 to 10 thousand.
Wow, wow. That is just like a flight ticket, like a basic minimum flight ticket to Goa. And you
Yeah.
are, yeah, you would be sounding politically correct by not advocating and, not putting down salon facials. But I have the liberty as a customer. So I would
You should
openly say that, all these years when I was unaware about hydra facials and many facials, I've gone ahead into salons and scrubbed, steamed my faces and slathered it with cream by any technician who would pull out my blackheads from my nose, and done. That's it. My face would look good for the next 2-3 days, and then I'm back to normal. And of course, I've spent thousands and thousands of it, and the prices are exorbitant. So, but when I was introduced to clinics and to, hydra facials and medifacials, there is no looking back. When you totally understand that, that peel which you put in for like 5 minutes, 6 minutes, it does a lot better to your skin than those physical exfoliants which has been scrubbed onto your skin. The awareness is so much about chemical exfoliants, so people are realizing it. So any day, a medicated medifacial or a hydrofacial over any salon
Even,
facial would be my
I've
pick.
had a lot of clients come. We feel bad, but the whiteheads and blackhead extraction itself is an art. And an
I know.
experienced doctor, an experienced clinic would
I know.
probably even teach the nurses how to do, because I've had people come with scars of just gone somewhere, and the blackheads removal has been done so aggressively that have left itself scars on the face.
Exactly, exactly, exactly. Salons are good for your, hair spas and your pedicures, manicures. But if you're wanting to do anything substantial for your face, I would definitely, definitely suggest to go to
Yeah,
a,
but let's not
medical
talk
professional.
against the salons. I have a lot of friends who have salons also,
No, no, no.
so they're gonna call me.
I do have a salon. Like I
And they're
said,
gonna
like my
call me and
salon.
say, "How dare you?" But no, I mean, it's sometimes good. Salons have their own experience, and our clinics have their own experience. We leave it to the people, and it coming, like we forgot about what we were talking about, the cosmetic surgery part of it. Um, it is, I would say, when you are planning a cosmetic surgery, first is the desire, as you say, that you really want it. Second, it's a very personal choice. So please take it out of your mind and your system that what will that person say and what will this person say, and I have to answer 10,000. You don't have to answer 10,000 people. You have to answer yourself. There is this wonderful quote that Shushmita Sen says, and she was actually standing at a cosmetic, one of the Botox filler companies. I'm not going to name it, but she was standing and giving, she was a guest of honor there. And it's a beautiful thing. She said, if you are looking in front of the mirror and you love the way you are, the way you see yourself, then I'm happy for you. And that's really good. Stay happy. And that's wonderful. But if you feel that you want to tweak something about yourself and you just always have wanted it, and that's how you look at yourself in the mirror, then just go ahead and do it. So no one's judging you on both accounts.
Exactly, exactly. Like, that body positivity shouldn't be, mistaken for accepting
Body shaming.
everything.
Yeah.
Yeah,
I
you should,
mean, you
yeah,
should
you should
not
have
take
the
that because
freedom to
I'm
change
doing
anything if you don't
it.
like, but not for others, but for yourself. I mean,
Yes,
that's a
yes.
strong messaging that has to go. True.
Yes, so it's really important now. If I want to reduce my arms, I've been struggling in the gym, or I want to get a breast augmented, and I have been working out. I've been trying all kinds of exercises, thinking something is going to happen. It's not happening. But every day for the past many years, when I stand in front of the mirror, I look at myself and I say that this is I've always wanted it. I want it, and I really want to do it. Then the next step comes is choosing the right surgeon, choosing the right hospital, and people misconceive it as a body shaming. But yes, if you're happy, if I was a fat kid at one particular time, and I was very happy with that particular. Phase of mine, and then there was a phase where I felt personally that it's not even good medically for me. In my family there's issues of diabetes, hypertension, we have the obesity gene, and I became conscious not initially for just looking good. If you're, it's not that just because you're thin you look good. Like I had friends, and me myself was on the heavy side, but It's also your personality. So if someone is happy with the way they are and love their personality, it's amazing. But there are a lot of people who are self-conscious, who do get affected, who have insecurities, and it is just their personal psyche, and we cannot change it. They
Exactly.
want to do something, we just have to boost them and say it's okay. If this makes you happy, then fine. But that doesn't mean that is the end of happiness. Happiness comes from various other things internally, mentally. They have to finally feel happy in their body with whatever they achieve, whether it's just the way they are or post plastic surgery. Finally they must be happy mentally, you know.
Agree. Totally. On that note, somebody, like, we have couple of questions. The first question was about the thigh reduction surgery, or for that matter, we could cover other body reduction surgery tools. Like, somebody said that I cannot wear shorts because my thighs are big. The first thing, of course, you would say is exercise. But even after exercising and working out and dieting, if it doesn't go, is there any surgery to have a specific body part, as you mentioned that the arms
So
reduction could happen?
it's
Is there something
liposuction.
like
So
that?
body contouring is just a terminology that we give. When I say body contouring, it could be any part of the body. So liposuction is nothing but a method of body contouring. So
Okay.
liposuction is the only permanent technique of fat removal. Permanent fat removal in the body is
Okay.
liposuction. So you're physically removing fat cells from any area of the body, thereby giving it a particular contour. So if
Ah,
it's,
okay.
yeah, so a lot of, yes, men and women also I have seen having the issue with the thighs. I have seen very fit people, like really exercising, very fit, but for some reason not getting rid of one tiny stubborn pocket of fat in the inner thigh. And
Yes.
they could be really fit. They could have a normal BMI that says, Doc, why isn't this little pocket not going? So yes, liposuction is very simple. We make these little keyhole cuts, and they are made in areas in your groin crease that you'll hardly visualize, not even in your underwear line. And if it's just the thighs, we can do a liposuction. It will reduce your bulk. And the technique that I would do is done in a certain way so that you get a thigh gap. At the same time, you can also get bulk reduction all around circumferentially. So if a person is already very thin and they're just removing a little pocket of fat, it's very easy. It's hardly 20-30 minutes a procedure. But if someone has overall bulk in the thighs, then it could take us about 2 hours to 3 hours to remove fat from all quadrants of the thigh. Or, it depends. Arms are a very short procedure, it just takes 30-40 minutes. Whereas thighs,
Okay.
if it's the full thighs, it could take 2 hours.
And any downtime, any little side effects which you would want to talk about? Any downtime, any precautions need
With
to?
any liposuction, the only downtime is actually what happens is when we are putting local anesthetic fluid. So we have to put it underneath the skin to break the fat. And then we suction the fat in liquid form. So what happens is first 48 to 72 hours, you have a little oozing happening from the little tiny cuts that we make, which is a
Okay.
little annoying. So but for areas like just the arm, which is 30-40 minutes, you can go home the same day after the procedure. If it's just thighs, you can go home because it's just 2 hours. But yes, you will have a little leaking from those areas. You will have to keep padding it up so that and after 48, 72 hours, all that leaking stops. And then we make you wear a corset. Once you're on a corset, you can do all your daily activities. You can get out of the city. You can travel within 5 to 6 days. You can get back to your office within 6 to 7 days. But
So the
it's, yes,
corset
the first,
have to be worn 24/7.
see, for small areas, my patients, they sometimes are comfortable and by evening they go home
Okay.
for small areas of lipo. Now, if you're doing a lot of areas, say abdomen, and a lot of fat has come, or it's arm and abdomen, or back and abdomen, then it's always, I feel they are uncomfortable the first 24 hours. So I
Of course.
keep them one night at our clinic. And then by next day, they're walking the same day, but they feel more comfortable if they have
Agree.
something. It's difficult to manage at home. I would say 48 to 72 hours is the only time where you'll experience the maximum discomfort. And even though we give painkillers, I always tell them that you may not have 100% pain-free zone. You may have a little discomfort. So I
Agree.
just cheer them up by saying no pain, no gain. Just be mentally strong, and you'll get there. But anesthesia is absolutely safe. If that's the concern, our patients are alert within 10 to 15 minutes of the surgery. It's not life-threatening if you have chosen the right clinic, chosen the right doctor, understood about your doctor. So research your surgeon, whether it's their website, when you're looking for a clinic, understand their experience, their certifications, where they have had their training for that particular surgery that you are looking for. There are few surgeons who are experienced and into rhinoplasties or have had extensive rhinoplasty training, some into body contouring and face. So research your surgeon, see the clinic, make sure they have the good equipments which will make your surgery, at ease, and it will make your surgery also safe. So safety depends upon the surgeon, the surgeon's experience, the clinic that you choose, and all of this. And finally, then comes the cost, because the better the clinic, the better the higher end equipments, maybe the cost could be a little more. So that is
Okay.
how the cost differs. And again, a plastic surgery cost can differ from which plastic surgery, from a nose job to a butt to a breast. Everything will have a different cost. And also, these are all custom made procedures.
Yes, yes,
Like
yes.
custom made to a person.
Yes, we just had a quick question and I thought that we'll take it. Somebody mentioned that they got a lipo done some 3 months back from some other clinic, but they want to do it again at your clinic. Like somebody put in that they did a thigh lipo. So would want to understand that what should be the duration between two liposuctions, or how should it be done? Like is it
Also, it's
done in
important.
phases or at once?
Yeah, it's also important that if we have done the bulk reduction lipo, okay, some person could have a very, very big bulky thighs. And there are certain situations we have only done a bulk reduction. We have not removed 100% of the fat. We expect them to lose weight. See, the final result come not from the liposuction, but they will see a difference only if they are exercising,
Okay.
only if they are losing weight. Then to a point, they will see a reduction in the width. At one point, it will stop if they are not losing weight and not exercising.
Agree,
So
agree.
they have to make sure in the first 3 to 6 months they are exercising. They have lost weight from when we have done the liposuction, because and the final result only happens when they are exercising and when they are losing weight. Otherwise, see, liposuction is not a weight loss procedure, and it's not possible after the liposuction that they have not seen a reduction in bulk. If they have to go back to their surgeon and they will take the photographs, they will see that there has been a reduction. But if someone was on the very obese side, then a bulk reduction liposuction is done. That is, they'll see moderate amount of reduction in contour. They will not see skinny legs for sure. But
of course, your work has to be
yes,
done.
yes. But if
You can't
someone
escape
is
hard work by getting these lipos.
absolutely not. Liposuction is just an added measure to give a further contouring. But if you want to get the best final result, I am very persistent that you have to do week 3, week 4, aggressive weight training, aggressive diet control, and then you will see how that width reduces even more and more.
Agree.
Because the body takes some time to understand the fat has gone. So that will not show you a weight reduction also in the beginning. But after a couple of months, if you have been dieting and exercise, you will see a sudden drop in weight after 2 to 3 months.
Okay.
And then you will see your size shrinking even more and more. So it's a combination. I'm only doing about 60% of the job. 40% is that diet and exercise.
Okay. And we just had one more question. If I scroll a bit up, we missed it. It was like a very important question. I delivered a baby via C-section 4 years ago, but my stomach skin is hanging and breast also is loose. What procedure can I do to remove fat? A question about all moms. We get the mommy paunch. Always.
The mommy paunch, I think the simple solution is skin removal by doing a tummy tuck. Yes, it would leave a little long scar, but the scar would be kept in such a way that it would be within your panty line as much as possible, as low as possible. If you have a good skin quality, if it's just a pouch, like just 2 days back on my story, I had put, there's a lady in her late 30s, had pregnancies, had a little pouch, but her skin quality and muscle tone was very good because she has been exercising. Like 2 years back, she completed her family and her last baby. So I did not have to do the skin removal and tummy tuck. Just liposuction gave her a complete flat abdomen. So either you would need a liposuction or tummy tuck. I think when you come and meet us, we could decide. When I look at you, I would have to look at your skin tone, muscle tone, and see whether you need a skin removal or you can get away with a liposuction. But if the breast is sagging, unfortunately for some women, no matter how much exercises you do, either they lose volume, either it becomes too heavy and sagging, or they completely lose volume and it sags. So there are three situations. So if you've lost complete volume, but there is no sagging of the breast, you just do either lift with a implant or a fat transfer. But if the nipple has come down, it's facing downwards, the breast is sagging, and the volume is lost, you may need a breast lift, that is removal of excess skin with an implant. And if your breasts have become very big post pregnancies and it is sagging, then you'll need a reduction with a breast lift. So it depends in which category you fall in. So, we would have to see you in person. These are all your options. But once I see you, I can customize it and decide what exactly is it that you need.
Okay, okay. Yeah, exactly. Go to the doctor, exercise, have your portion sizes in control, live a healthy lifestyle, and then go to the doctor. I mean, of course, the doctor can help you, but if you do not do the right things, you would never see.
Yeah. So yeah, also it's important that you must complete, like there are a lot of unmarried women who do liposuction. It is okay, but you must know that whatever cosmetic surgery is done at any point of life, as long as one maintains their body the same way, the result of surgery will remain the same. But anytime a body changes drastically, so will the result of the procedure. So if you are doing a tummy tuck, please do it after you've completed a family. If you're doing a breast lift, please do it after you've completed the family. There are a lot of youngsters these days who have a different mindset. The new Gen Zs or the generation is very different. I've had young girls coming to do a breast reduction. They are okay with the scars. And they even know the fact that tomorrow they get pregnant and have a children, maybe the breast shape will change. They're okay about it. And they are ready to do a revision at a later date. I think today's generation, the early 20s or the late 20s, they're more gutsy than us.
Of course.
But they are definitely more aware about the pros, cons, the do's and don'ts, and they know what's going to happen. And it's our responsibility to tell them that in the future, these are the things which are going to change. But you must know that you may need a revision procedure at a later date. Or, if your body changes, then so will the result. But today's younger generation are more bold and they know exactly what they want and what is it that they are looking for. So they come with a very, very straight and a positive thought process.
Okay. Just another question which you mentioned. I think somebody came in and said, I've done love handle lipo in Chennai and I'm doing weight training, but I'm not seeing V shape, still the same only. As you mentioned, it has to be continuous, right? It has to be
No, it has to
persistent.
be continuous. I think you must work on your strength training a little bit more. Wait for 6 months for the final result of your liposuction. So don't be in a hurry. In liposuction, 2 to 3 months, still there could be swelling. Remember that up to 3 months, the lymphatic massage, there are these certain massages called lymphatic massages. If people are not following it on a daily basis, they will see that the swelling is still there. And that is why maybe the skin is still hard for you. So one is just check if your skin is still hard. Is it still swollen? Wait for 3 to 6 months, do aggressive weight training, and then see after 6 months whether if it's still there, it could be maybe a little skin laxity. You can do some skin tightening lasers or go back to your surgeon and find out. Like sometimes a small revision procedure may be needed. Meet your surgeon, discuss it, and I'm sure they will give you a solution.
Yes. Okay. So I think we actually covered a lot of myths around fillers, and thank you, doctor, for all the knowledge. I'm sure this would be helpful to anybody who's looking to it.
Yeah, I think we covered a lot of stuff, not just fillers and Botox. And I think very valid questions. And thank you, Tanvi, for having this chat with me. And thank you, everyone, for listening and allowing us to impart our knowledge.
Somebody says your number is not reachable, so you just have to go and check your because
my number is not reachable.
Somebody just mentioned that they're trying to What's the
Uh,
best number to reach you? Doctor, you have to
um,
update your clinic
So
reservation
our
number.
clinic is open. Clinic is open between 10 to 7. So maybe after 7 o'clock, my staff would have been, going back to the houses, and maybe
Somebody
the
is called,
clinic
yeah.
numbers are not reachable. But I
Yes.
think between 10 to 6:30, try to get in touch with us. It's on our website, www.kaesthetics.in. You'll find our clinic numbers, and those are the numbers you can contact, or you could just DM us on Instagram, and our social media team will reach out to you, leave your contact information, and I guess in 24 hours, we try our best that our team gets in touch with you.
Great then. Okay, that's it from my side. Thank you. Thanks
Thank you so
everybody who joined in. Thank you.
Thank you
Bye.
so much. Have a good week. See you soon, Tanvi. Bye.
Yeah, see you soon. Bye.